talk about my favorite topic in the whole world, but Lisa's only giving me 10 minutes, so you're going to have to listen fast.
I'll give you 11.
So let me tell you about normal pregnancy. In normal pregnancy, there's an increased insulin secretion, and this is because women are hungrier, they gain weight, they start to be sedentary, but also the anti-insulin hormones coming from the placenta increase the need for more insulin production. And therefore, there's a 2 to 4-fold increase in insulin secretion in normal pregnant women. Now, it is true that those women who can't make enough insulin during pregnancy to compensate for all of the factors, they will become hyperglycemic. Now, right at this moment, there's a great debate. And the great debate is, how do you diagnose hyperglycemia in pregnancy, or what we call it, gestational diabetes? In fact, there's a whole caucus around how do you make the diagnosis, how high do the blood sugars have to be before you call it gestational diabetes. But the truth is, these are women who can't make enough insulin to compensate for the insulin resistance of pregnancy. But each pregnancy is unique. In this case of women with type 1 diabetes, there's an increasing insulin requirement. And it does have to do with her appetite, her exercise, and how she feels about life. But it is really consistent that she should have an increased insulin requirement throughout pregnancy. Non-pregnant women have an insulin requirement of 0.6 units per kilogram per day. And as soon as they become pregnant, it increases to 0.7 units per kilogram per day. And throughout pregnancy, there's a smooth rise of the insulin requirement up to 1 unit per kilogram per day when she's about to deliver. Now, women who have type 2 diabetes and more insulin resistance, we can see insulin doses up to 2 units per kilogram per day. But now I have to tell you, the most ominous sign during pregnancy is a drop in insulin requirement.